Obesity or Sthoulya is a very common metabolic lifestyle disorder that we come across in our hospital. Ayurveda offers a well structured, time tested, and a holistic treatment approach to manage obesity and its related complications. Namaste. Today we are going to discuss obesity in Ayurveda and its treatment. Which doshas become obstructed or avarana in obesity? Why our body's fire element or Agni increasing and decreasing at the same time? Let us understand obesity from its root cause and move towards natural healing. Let's begin. Sthoulya is a Shleshmala Nanatmaja Vyadhi, that means disease occurred due to vitiated Kapha dosha. It is also a Sandarpanajanya Vyadhi, which is disease occurred due to overnourishment, and Acharya Charaka considered this as one among the 8 undesirable persons or Ashtanindita Purusha. The root word of Sthoulya is tu, meaning to grow or expand. So Sthoulya is excessive bulkiness or it indicates abnormal growth. And what is the definition? According to Acharya Dalana, Sharira Upachaya, increase of body is Sthoulya, whereas Apachaya, decrease of body is Karsha. Let us see the dosha and dusha involved here. Dosha is Kapha Pradhana and Vata dosha also get obstructed or avarana due to excess fat or medas. The Agni is simultaneously increase and decrease that we will see in coming slides. And about dusha, the primarily Medha dhatu, secondarily Mamsa dhatu, and there is also Rasa dhatu involvement. That's why Sushruta says Rasanimitam evam Staulyam Karshancha. Now we are going to analyze cause, signs and symptoms, pathology and complication. This is a beautiful shloka from Sushruta Sutra 15th chapter. Here we can able to understand Sthoulya in an easy way. So let us decode the shloka word by word. The causes explained are Shleshmala Ahara Sevino, the person who takes food which increases Kapha dosha, for example, excess sweet or heavy food. Adhyashana Shilasya, which means taking food before the previous meal get digested. Avyayamino, those who doesn't do any kind of exercise or movement. Diva Supnatarasya, those who indulge in daydreaming. In these people, there will be formation of ama, metabolic waste, which combines with anarasa, the essence of food, and it attains the peak of sweetness, madhuratarasya. Then this circulates all over the body, shariram anukramya, adhisneho medo janedi. That means due to excess sneha or fat tissue, there will be same increase of medas. Tadadhistaulim apadedi. That's how Sthoulya is happening. Now let us see the symptoms. Shuddra Shwasa, exertional dyspnea. Pipasa, excess thirst. Shuddh Sopna, excess hunger and sleepiness. Gatra Daurgandhya, bad odor. Kradana, weakness. Gatra Sada Gadgadatvani, tiredness and change of voice. Because of Saugumari and Medasaha, the person cannot able to do his work, sarva kriyaso asamarthaha. And on other hand, there will be obstruction of channels by kapha and medas, which result in alpa vyavaya or reduced sexual capacity or impotence. Another major issue is this obstruction leads to blockage of nourishment to uttarottara dhatu tissues after medha. They are asti, majja and shukra. So these dhatus will not get nourishment. When this continues, the person will end up in complications such as Prameha pedaga, diabetic carbuncle, jwara, fever, Bagandhara, fistula, Vidradi, abscess, and Vata Vikarana, for example, cerebrovascular accident. Here is the same Charaka version. I will explain in short. There will be Nidana or causative factor, which leads to obstruction of body channels or shrotas by Medha dhatu and end up in confined movement of Vata in Koshta. This in turn stimulates the digestive power or Jhataragni Vriddhi. Then the person will become voracious eater and there won't be any Uttarottara Dhatu nourishment. Here is where we discussed earlier that there will be both Agni Vriddhi and Kshaya happens. Agni Vriddhi in the sense Jhataragni Vriddhi, the digestive power. Agni Kshaya happens in Dhatu Agni level or in the microcircular level. Here the Medha Dhatu Agni decreases and it affects in the nourishment of further dhatus. So always keep in mind there will be both Agni Kshaya and Vriddhi in obesity. Another aspect of Sthoulya is Ashtadoshas. We will see it one by one. This is the reference. First one, Ayushorhasa, reduced lifespan. Javaparodha, limited movements. Krishravevaya, reduced sexual activity or impotency. Daurbalya, weakness. Daurgandha, bad smell. Swedabadha, profuse sweating. Shuddhadimatra, excess hunger. and pipasa atyoga, excess thirst. Now the last and most important part, chikitsa or treatment. वातग्न अन्नपानानि श्लेष्ममेदोहराणि च रूक्षोष्णबस्त्रयः तीक्ष्णरूक्ष्यान् उद्वर्तनानि च गुडुचि भद्रमुस्तानां प्रयोगस्त्रिफलस्तदा तक्रारिष्टप्रयोगस्य प्रयोगो माक्षिकस्य च. This reference is from Charaka Sutra 21st chapter 21st shloka. The shloka goes further. Let us see the main treatment indicated. Ruksha Ushnabasti, medicated enema. Udvartana, powder massage. Use of Trifala, Musta, Takrarishta, honey, shara, yava. So basically diet, lifestyle and treatment that elevates vata dosha and reduce kapha dosha and medha dhatu are indicated. This is the treatment for Shleshmala Vyadhi, disease of kapha origin. The reference is taken from Charaka Sutra 20th chapter 17th shloka, which says Katutikta Kashaya Rasa Pradana Aushadas should be given. Then Tikshnoshna Rukshna Upakrama, treatment which are strong and hot in potency. Sweda, medicated sudation. Vamana, emesis. Shirovirechana, nasal medical administration. Vyayama, exercise. Among this, Vamanam tu Sarvobhakramebhyaha. Vamana is the best. And this is the continuation of previous Sushruta sloka where specifically Lekhana Basti is indicated. But at the same time, another reference from Chikitsa Sthana says Anuvasana Astapana Bastis are generally not preferable for Sthoulya. So when we are giving treatment, analyze the patient, Purusham Viksha, then administer therapies and medicines. Panchakarma. We are going to see stepwise treatment approach that we follow in our hospitals. Let's have an overview first before going into detail. At first, Rukshana Chikitsa followed by Deepana Pachana, Snehana Swedanadi, Purva Karmas. Then Pradhana Karma according to the patient. And finally, Pashat Karma with medicine, diet and lifestyle. Rukshana Chikitsa. In this reference, we can see persons indicated for Rukshana. Mamsala, Medura, Buri Shleshma, Ama all comes under obesity. And Rukshana is achieved by Udvartana, medicated powder massage, followed by Bashpasweda, Kashayadhara or Takradhara. The options for Udvartana medicines are Trifala Churna, Kolakulattadi, Yava. It opens the Siramukha. It facilitates the digestion of Kapha Meda, mucus and fat. As a result, Kapha Meda liquefies. Here you can see Shiromugam Vibhitratvam, Toktesha Agni Dhibanam, Kapha Meda Vilapanam, Sthitikarna Mangana. And Swedana further aids digestion of fat. It elevates stiffness, heaviness, and it promotes metabolism by opening skin receptors. Cutaneous vasodilation helps to eliminate metabolic waste, and it reduces subcutaneous fat. It opens minute channels to improve blood circulation and lymphatic drainage. Now Panchakarma or Shodhana, starting with Deepana Pachana, followed by Purva Karma and Pradhana Pashat Karma. According to Ashtanga Hridaya, obesity patient should undergo Pachana Deepana before. The medicines options are Agni Tundi Vati, Chitragadi Vati, Shaddharana Churna, Pipali and Hingwashtaka Churna. Now comes Snehana or medicated ghee intake. Some options are Varunadi Grita, Mahatrifala Grita, Amrita Prasha Grita, Panchatikta Grita. It loosens the other doshas from peripheral tissues or shakhas. Then we will go for Svedana. What it does, it brings back doshas from shakha to the koshta for easy elimination. And should go for Pradhana Karma according to the condition. Vamana, Virechana or Lekhana Basti can be followed. Later on, Samsarjana Krama, diet and lifestyle. So by all this, we are setting up a lifestyle for the patient, then he or she has to follow. And the medications options are Varunadi Kashaya, Takrarishta, Pipalyasava, Trifala Gugulu, Medhodara Gugulu, Navaka Gugulu, Mustadi Kashaya, Lohasava, Aiskriti. These are some of the options. I hope this video on Sthoulya helps you to understand obesity from an Ayurvedic perspective in a simple and effective way. If you found it helpful, don't forget to subscribe for more health related Ayurvedic content.